My motivation for working on this particular study was due to my own personal journey with my parents both being diagnosed with cancer. My mom diagnosed with breast cancer, and my dad diagnosed with leukemia. And then also, I have to make sure that I keep track of my own health, being diagnosed with Crohn's disease for colon cancer, to make sure that I take all the measures I need to make sure that we're safe. I learned from my parents that you have to listen to them, and communication is very key. If a patient or a person or family member, a caregiver is telling you they don't feel well, you have to believe that they don't feel well in that day. They may not want to get out of bed, they may not want to eat, they just may want to sit there. So I believe that listening to them and just being there when they need you to be there, how they need you to be there, is very important. I most definitely have to watch out for my own health. I pay attention to everything. My dad is one of 14, and his side of the family is very heavy in cancer. All of his siblings usually die from some sort of cancer. There's only six of them left, and they all have a diagnosis of cancer. So I think it's very important to pay attention. I pay attention to my dad, how he walks, how he talks. If there's a slur in his voice, I know that he's not feeling well today. Do you want to go to the doctor? He may say yes, he may say no. He may wait till the last minute to go, but to pay attention to what's going on with a person so you can know if they're starting to decline, because they won't always tell you because they feel like they're trying to protect you as a caregiver or as a family member. They'll just suffer through. So I think watching them, going to the doctor with your family members is also something that is very helpful, at least once a month, so you can know about their medication and the side effects and everything else the doctor is telling them, because they will keep things from you as well to try to protect you as a family member or a caregiver. So you can learn the doctor and the team and have that relationship to be able to call the doctor if they give you that the permission to say, hey, this is what's going on today. Do we need to come in, or are they okay? So you can have a peace of mind as a caregiver as well, um, to just help you understand everything that that person's going through. I believe that communication is a very important factor, because you have to listen to the family member or the patient. When they decide that they're done, they're done. And you have to discuss the hard situations. You have to talk about death. You have to talk about what to expect after. And just realizing that they're the person that's going through the treatment. And throughout my experience working in the hospital, I saw patients who would take treatments and their family members would come and visit, and when they leave, they're crying because they're the one in pain. These treatments cause a lot of pain. They have a lot of side effects. So you have to communicate with your caregiver, with your team, with your doctor, to let them know how you feel. And if a patient wants to stop, they'll just have to stop. In my own personal journey, when my mom was decided she was done with chemo, it was hard to hear that, but she was a patient, and I promised myself I wouldn't allow her to suffer just so I could feel good about myself and her being here. So I had to accept what she wanted to do, and that was to stop her chemo. And that was, her transition period started soon after that. So just listen to them. Listening is an important piece. I think that therapy is a big part of having an illness, and there are therapists who specialize in chronic illnesses. And sometimes it's hard to have conversations with your family, or if you don't have a supportive family, you can go to those people and express how you feel, express what you're going through, to help you to think about everything that you have to decide. You have to make a lot of quick decisions when you first diagnosed, and I learned that from my my own treatment plan. I was diagnosed, and suddenly after, there were all these chemos and biologics I had to take, and I had no idea what to do. And I found support groups as well that helped me. To be around people who are kind of like you helps a little bit more, because you see how everyone deals with your disease differently. And my mother, my father, they had each other in two separate diseases, but they were able to communicate how a medication was making them feel, or how it was making, someone else feel. They were able to get all those things out. So I do believe that talking it out is very good. And for me, I learned to, my therapist was my person that I went to in the support groups, because with dealing with Crohn's, A lot of people in the African American culture have no idea what Crohn's disease is. It's more European disease. So I had to make my culture aware, my family aware of what the disease is, because um, I believe that awareness is very important for people to understand who you are and the things that you're going through and why you're going through them. And if I say I can't get up out of bed today, whether I have Crohn's or cancer, whatever it is, I can't get out of bed today. Yes, I may have been laughing yesterday, but today's a different day and I'm ill and it's chronic and it doesn't just go away. I live with it every day. And that you have to help people understand that with certain diseases. With my dad's leukemia, it's chronic. You know, it's not something that it's long term. There are days where he's good and there's days where he's not. So I just have to realize that he's not feeling good this week. He might have been in the yard mowing the grass, went on a trip last week, but this week is a different week. So just really understand and listen and have outlets where you can talk to other people. It really helps. As a citizen scientist, I can help reach the community. One, because of my own personal journey into my background in healthcare. I've learned that a lot of patients don't necessarily trust their doctors in, or they're just afraid to ask questions because they don't want to offend anyone. So I think when they have a group of people who have dealt with an illness of any sort, they can kind of relate better and to help them understand, because there's a lot of verbiage that physicians use or researchers use that we the people don't really understand, and so we can help break those things down or help the teams to break it down to where they can reach the community a whole lot better, because I do believe that research is important, to get the community involved to do more research. So as a citizen scientist, my goal is to help reach the community, to help them understand the things that they don't, to make it very clear for them to be able to participate where they're needed.